Welcome back, everyone. Today we're going to go on a fascinating journey into the profound connection between physical exercise and brain health. It's a link fortified by a wealth of compelling research evidence. Movement in the context of promoting brain health emerges as one of the most extensively studied of the various lifestyle interventions. As we delve into the nuanced world of exercise and movement, we'll unveil the myriad benefits that transcend the usual ideas of muscle tone and cardiovascular fitness. So just prepare to discover the profound impact that movement can have on the brain, the body's most intricate organ. In its various forms, movement becomes the key to unlocking a healthier, sharper, and more resilient brain. So join me now as we uncover the often overlooked and undeniable benefits of exercise for our brains, supported by a vast body of research and accessible in some form to everyone seeking optimal cognitive well-being. A couple disclaimers or reminders. The information that will be presented is for educational purposes only and does not constitute medical advice. Don't start any new exercise program without consulting your primary care provider, particularly if you have other health problems or if you've been inactive for some time. And please be cautious about performing any movements that are beyond your ability, and consult your physician first if you're unsure. My light is a little off. Okay. Let's begin with a story. So if you were in the class, you will remember that this is the point at which I had you go ahead and do 10 minutes of some kind of movement to get your heart rate up and your breathing up a little bit. So you will have come back after your 10 minutes of this burst of energy to learn what I did that for, or the reasons that we did that in this portion of the program. So let's begin with the story. Dr. Steen and Alicia Sherzai talk about a 54-year-old gentleman, Jerry, who had recently been diagnosed with vascular dementia. And they discuss this in their book, The Alzheimer's Solution, which is one of the books on our resource list. So he had been diagnosed with vascular dementia, which is related to low blood flow to the brain. His brain scans showed areas of the brain where there was decreased blood flow that had caused damage to the brain tissue, like small areas of strokes. He was slow in his responses when they first met him at his initial visit, and everyone around him, including his wife and friends, had all noticed the same thing. And in fact, Jerry had noticed it. He struggled to remember names or even to follow normal conversation. But just in asking him what his name was, it took him several seconds to think about it and then respond. And this is a sign of early dementia. He and his wife normally commuted long distances to and from work. He was still working as an insurance salesman, and neither of them actually, had time in the evenings for meal preparation, and so they ate mostly fast food, or at least a large portion of meat daily, and exercise was not a part of their life. His wife Rose brought him to see them, reluctantly by the way, and to have him evaluated. So let's get into our talk, and we'll come back to Jerry in just a little bit. Today we're talking about moving. So this is called Moving Day, and we'll be talking about movement in all its beautiful forms. We're going to be looking for movement that gives you pleasure, as opposed to the work of exercise, which can become as stressful as anything else we do in our lives. If you've ever been injured or you could not move normally in your life, you may have developed an appreciation for the simplicity of just being able to walk, to dress, or to shower, or just to do the simple things in your life. So let's look at movement and exercise from this perspective with an appreciation for the effects that it can have on your brain. The agenda for tonight is going to just be, we're going to talk about why move, and we're going to talk about the risks and benefits of movement, the types of movement that you can do to improve brain health, and again, the risks we'll go over a little bit more in depth at the end of the talk. So when we in conventional medicine are prescribing a new drug or therapy, we weigh the risks and benefits of the recommended treatment. And so we're going to do that with movement today and just look at that risk-benefit ratio when it comes to movement as a therapy for brain dysfunction. First of all, When it comes to the benefits, I have 2 full pages written out like this. I'm going to show you them, and we're going to go over them in more detail. I don't want you to memorize this or even to read all of it off. I just want you to know that there are a lot of benefits, 2 pages worth here. And when it comes to the risks, we have kind of a short list of risks. So we'll be talking about that, the risks of injury to muscle and ligaments, especially if your body is not acclimated to being active. So people can also over-exercise, and that can be a problem also. So let's start with this idea of trying to find a pill to make our brain health better, so to improve our brain health. And the pharmaceutical companies in the United States have spent billions of dollars and more than 20 years in search of a drug that could reverse Alzheimer's or could even stop it. And the 2 most recent ones that are out on the market have some very serious risks, and to the point that they were not even accepted in the European Union by the equivalent of the FDA, the Federal Drug Administration there in Europe. And the reason was because it could cause bleeding in the brain. And, you know, when you're trying to improve somebody's brain health, that is the last thing you want to do. That's called a stroke or a series of mini strokes. Either way, it's not something that you want. And then if you look at the risk ratio of these drugs, they are pages. There are pages of them for the different risks that can occur from using these medications. Really right now, they're only being used for somebody with very mild dementia. They certainly don't want to use them in somebody who's already pretty far into the process because they don't want to make it worse. But it was interesting when Rose brought Jerry in, that was what he wanted to know. He wanted to know if there was a drug that would help his dementia. And they told him, absolutely, there is a medicine that boosts and optimizes your brain's immune system. It increases the size of certain parts of the brain that are needed for memory. It increases the chemicals in the brain that are needed to grow new blood cells and strengthen the connections between the existing brain cells, rather. I said blood cells. Grow new brain cells and strengthen the connection between the existing brain cells. And it reduces anxiety and depression. It lowers weight. It lowers the risks of diabetes, and it helps with sleep. And he said, great. You know, all his other doctors had given him a pill to help with his blood pressure and his diabetes and his heart disease. And so he said, go ahead, just give it to me. And they said, okay, it's exercise. And he was quite disturbed about that. He knew that exercise was good for you, but he had never heard that exercise might be actually good for your brain and your brain function. Among the various lifestyle changes available to us, it seems that exercise right within our reach might be the miracle drug that we're actually looking for. So let's look at this just a little bit more. So we talked about it helping to control blood sugar. And this is really important because in our first class, we talked about blood sugar being a problem when it comes to brain function. If your body and your brain cells become resistant to the use of sugar because you are diabetic or pre-diabetic, or you have metabolic syndrome, that's another name for pre-diabetes, it will make it so that those brain cells will not work. And if we can get the cells accepting the sugar a little bit better and using it better, that is one thing that is going to improve brain health. And so walking after a meal is particularly helpful for lowering the blood sugar in the body, but also for improving the sensitivity of the cells of the body, including the brain, to insulin. And insulin then helps the blood sugar go into the cells where it's needed. But your body becomes resistant to that. And so walking after meals will help improve that. It improves sleep. We know from our second class how important it is for our brain health that we sleep soundly and deeply. And if you are exercising on a regular basis, you will sleep more deeply. You have to be careful when you exercise or when you you have to be careful when you exercise in terms of times of the day, because some people, if they exercise too close to bedtime, they will not be able to fall asleep. So we like to limit it to a morning routine or an early afternoon routine for most people, especially if we're dealing with sleep problems. But it will help you sleep more deeply. It helps us maintain a healthy weight or body mass index. That's also another term for healthy weight. With regards to the brain, this is going to be particularly healthy for several reasons. If we can move our bodies more easily and effectively with less risk of injury, because we weigh less, that will be one benefit. It means that we have less inflammation, because if we have less body fat, then we're going to have less inflammation in our body. Fat is inflammatory for our body and our brain, and inflammation is not good for the brain. It's part of the process of Alzheimer's, and it's part of the process of laying down abnormal protein cells in the brain called amyloid, or in other cases, it's tau proteins. There's several other types of abnormal proteins that get laid down in the brain in response to inflammation in the brain. So, and then of course we talked about sleep and sleep apnea last time, and the people that have a tendency to have sleep apnea are often overweight, and if we can get their weight down, sometimes we can also make a difference in their sleep apnea. So it's often one of those things that we try early in mild sleep apnea to see if we can get a better airway, more room for the air to move through the airway, because there's less tissue in the airway, less fatty tissue, and less tissue in general. Of course, we all know exercise is good for heart health, but it's really good for vascular health. And when it comes to the heart, vascular health is necessary in terms of having wide open vessels. And this is also true in the brain. You want the blood vessels to be as open as possible, not contracted down or narrowed because of high blood pressure, which it thickens the wall and narrows the opening in the vessel, and you get less blood flow to both the heart and the brain. So the healthier the vessels of the body are, the more open and functioning they're going to be, and the more we can get oxygen-rich blood to critical areas of the brain, but also to new areas of the brain that we're trying to flood with oxygen. So interestingly, we just talked about blood pressure for a second there. When your blood pressure is high, it is pushing against the vessel, almost like pushing against a brick wall, and it's causing the blood vessel wall to thicken because of the muscular layer of the blood vessel. It's one of the reasons that we see lower blood flow. Even though the pressure is higher to push the blood through, it's causing a narrowing of the blood vessel, a thickening of the wall, a narrowing of the vessel, and less blood flow to the organs of the body, whether it's the legs, the muscles of the legs, the heart, everywhere, and the brain. So exercise stimulates the brain to make chemicals that are involved in the production of new blood vessels. So we have the larger vessels are the old blood vessels, but it also stimulates a chemical that causes new blood vessel growth. And that allows for new blood flow to areas of the brain that might be new areas because we've grown some new blood cells, but it just might be that there's an injured area that you want to have better blood flow, and exercise will stimulate the growth of those vessels into these new areas or into old areas that just need new blood flow so that they can take over the function of the areas of the brain that are injured. Okay, so let's just see. Again, exercise causes the brain to produce what we call cytokines. These are chemicals that balance or regulate the body's immune system, and also decreases both brain and body total inflammation. So it ramps up the immune system in some ways to fight off infections, maybe that are floating around in the bloodstream. Maybe somebody has teeth that have bacteria. Maybe they carry a lot of bacteria between their teeth and their mouth, and some of that gets into the bloodstream and starts floating around. That can affect the vessels of the heart and the vessels of the brain or the tissue of the brain. So just improving your immune function from exercise is going to help greatly with that. It just simply upregulates the things in your body, the cytokines rather, that will balance the inflammation in your body and your brain especially. Again, we don't want inflammation in our brain any more than we have to have it. We don't really have to have it. You only need inflammation if you're fighting off an infection or some kind of injury. But other than that, we want the inflammation down, and just doing exercise will help balance and regulate that process. So we get normal amounts of inflammation when we need it, and not abnormal amounts that are causing these abnormal proteins in the brain. So here we are with an abnormal protein. This is just supposed to be kind of a graphic depiction of amyloid beta, which is the one that you hear about when it comes to Alzheimer's. But we have different abnormal proteins that get deposited into various portions of the brain, various parts of the brain, depending on the type of dementia that we're dealing with. So in this type of dementia with Alzheimer's, we might have this deposited in the frontal region for the executive function, those two areas in the front, or we might even have it in the central area of the brain where we have memory and we have regulation of emotions, things like that. Whereas in Parkinson's, when we see somebody, and Parkinson's can have, not always, can have some degree of dementia associated with it, but it also is an abnormal deposition of protein in the balance center of the brain. And I'll show you that a little bit later in this program. So it's an interesting fact. I wanted to tell you this, that Alzheimer's gene appears to have originally been developed in us as a protective gene, because what it did was it actually increases inflammation. So it was supposed to be protective against infection and against, like I say, any kind of damage. And it still does that. So it increases, these people who carry this gene have a tendency, not always, but have a tendency anyway, to have increased inflammation in their body. And so that's one of the things we do with them, is to downregulate this inflammation. But it was originally a gene that was supposed to be more protective. It's just that we don't need quite that much protection in our culture these days, the way we might have, 2,000, 3,000 years ago or 10,000 years ago. But we still have the gene floating around in our population, increasing inflammation just in case, and causing a lot of damage in the meantime. So exercise produces feel-good chemicals for our body. And I think this is such a lovely, lovely thing for exercise to do, and really, really good when we're dealing with emotional health. So serotonin is the chemical for peace and tranquility. We get some dopamine. It gives you a sense of reward that you're doing something good for yourself, and it makes you feel good. There are beta endorphins that are being produced, and endorphins are good for pain relief and just feeling good. It's like your body, it is your body's natural opioids. That's what endorphins are. And they are produced when you are doing exercise in which you are out of breath for an extended length of time, usually above 20 minutes. You'll start to feel that endorphin release, not so much when you're exercising, but after you stop. Over the next hour or 2 or 3, even sometimes the rest of the day, you would just feel so much better. Anandamide is the bliss hormone. It's produced during exercise. We have one more that isn't norepinephrine, noradrenaline or norepinephrine. It's the one I have people work for or do exercise for when we're looking for increased focus. So somebody who's all over the map, who can't focus really well, norepinephrine is the one that's used and produced during exercise. So with all those feel-good chemicals, of course, it's going to lower anxiety and lift your mood. And I think it's wonderful as a mood lifter. Now, there's a fair amount of research that shows that in general, the use of exercise in those who have low to moderate depression is actually as effective as an antidepressant in low to moderate depression. And I have seen it work many times in my patients. So it's I don't hesitate to prescribe it. We start low and we work up slowly, but it's always interesting. It's always fun when somebody says, wow, I just feel so much better after I do this. This is my personal favorite when it comes to brain health and cognitive dysfunction, is the chemical called brain-derived neurotrophic factor. It is actually considered a fertilizer, like Miracle-Gro for the brain. And exercise, when you're exercising, it produces this fertilizer in large amounts. More than any other lifestyle habit. I think you can get a little bit with some foods, and I think you also get some with meditation. So those are some other possibilities. But exercise, when you exercise, your brain is flooded with this chemical. This chemical is used for making new connections between brain cells and also making new brain cells. So um, research shows that when you can use this to our that when we can use this to our advantage, when we're learning something new or when we're repairing the damage to injured brain areas, that we can see a remarkable difference in a person's ability to think clearly and to process and to remember things. There's a lot of really nice research on this, and sometimes I use it before exercise or before I'm learning something, just like I had you, all of you do today. I had you go out and do that walking and get your heart rate up a little bit. Sometimes I actually use it after exercise, and it can be after learning something, and it can be just as effective as using it before you are trying to learn something. So this next slide, I had a couple of YouTube videos that I presented in class, and I can't do it on this particular slideshow, but it will be in the resources, and you'll be able to just click on the link and watch these 2 YouTube videos. And they show the neurons as they are growing and connecting to each other. The first one, it shows just 2 neurons making this connection, which can occur over about 14 seconds. And they show how this happens in real time on that video, how 2 neurons reach out towards each other and then connect. It takes about 14 seconds. And the second one is, it's presented over a number of days, I think probably 5 or 6 days, and it just shows this massive new brain growth, new brain cells, and new connections going back and forth and forming connections across the brain and just growing new brain tissue. It's a really fascinating video of a electron microscopy video of this process. It's beautiful. So think of the brain as having multiple interconnected nerve cells. So a nerve just doesn't connect to one other brain nerve cell. It connects to as many as it needs to stabilize that brain function. So if it's learning a new exercise, if it's learning anything new for that matter, it will be making numerous connections to other brain cells. And that's what we want to do. The more connections a brain cell has to other brain cells around it, the more stable that brain cell will be. Just like when you have a spider web, this central region, just think of that as the brain cell at the middle, and all of these different connections to the rest of the web stabilize that brain cell. And that's what we want to do in our brains when we're learning something new. We want to connect it to as many other things as possible, whether it's a movement, a memory, an emotion. Emotions are particularly helpful to connect brain cells and memories to something that will be more stable and you'll retain for a longer period of time. So think of the nerve cells as being, hold on. This would be an example of a nerve cell or brain cell with many arms that reach out and essentially trying to stabilize itself by connecting, making new connections to the surrounding brain cells. Okay. When we use our bodies, we are forming numerous new connections in the brain because movement requires so many different types of brain cells and types of areas of the brain in order to do this kind of thing. So if you think about this, each part of the brain has a specialized area, but it has to connect to the other parts to make it work in a coordinated effort. So when these different areas of the brain and different types of nerve cells are firing together, they form new connections and they reinforce the old connections in numerous ways. So if you look at this photograph of this woman and her husband, here they are dancing. So they're listening. They're using that portion of the brain for listening, for memory, for emotion, for movement of the arms and the legs. So it's partly sensation, it's partly balance, it's all these different things. And it's stabilizing new memories and new parts of brain tissue. So, and this is just one type of body-brain movement. Here's another type. So this would be Tai Chi. Tai Chi is a slow movement. It's very balanced. It's going to use the balance centers in your brain. It's going to use the sensations in your body and your arms and your legs. It's going to use memory. probably a little bit of emotion here. Just the same thing that we just talked about with the dancing. There's a lot of different parts of the brain that are being um, recruited in order for somebody to do this kind of motion. Here's another one, a little bit of yoga. This is a really simple movement, but it's still taking all of those areas. It's taking the balance centers, the sensation of your legs, your arms. They're watching her, so they're following instructions. So, listening, visual, all of those centers, all of those areas of the brain are being used for this. Here's another one for aerobic dance. These people are having a lot of fun with this. They're following her instructions. And again, all of those different areas of the brain are being recruited to do this kind of activity. And it's just another way to stretch the brain outside its usual limits. Now, I only had one slide for this, but this is supposed to be a slide regarding strength training. And strength training can be free weights. It can be calisthenics, where you use your own body weight to do certain things. It can be using weight machines, resistance bands, those exercise bands that are dirt cheap and very, very effective for building a little bit of muscle on you. And interestingly enough, even though it doesn't seem like they're doing that much, they're still doing some of the things that we talked about before, where they're listening, they're following instructions, so they're using the auditory and the visual portion of the brain, but they are also building muscle. And just building muscle has the ability to strengthen the frontal lobes. This is the cortical region, the frontal lobes. This is for executive function, for deciding you're going to do something, planning, and following through with it, following a recipe, being able to decide you're going to balance your checkbook and do it, things like that. So this portion of the brain is really critical. It's one of the first areas that we have trouble with if we're having trouble with dementia and cognitive dysfunction. And it's muscle strength or muscle building, strength training that actually influences that area of the brain the most. So really, really good to do that. It doesn't have to be large amounts. It can be, 10 minutes, 3 times a week, and start again really low and work up gradually. So this is the area that it helps, the frontal region of the brain, or prefrontal is what it's called, the area above the eyeballs there you can see, and again, for executive function. The other portion of brain I was going to show you was this the back of the brain at the base there is the cerebellum, and it's more for balance, but a lot of these exercises are using some degree of that cerebellum for balance. And I don't really have it shown here. The central region of the brain is really more for the emotional function of the brain. So let's talk a little bit about high intensity interval training. So this is a kind of interesting, it's something a little bit newer. What we're finding is that we need to, when we exercise, we're finding that the most effective way to do exercise, because of it being able to do all of the things we're talking about, is to do kind of a low level of aerobic exercise interspersed with these short bursts of energy. Now, the short burst of energy might be 20 seconds, 15 seconds. It could be 15 minutes if you're ready for that. But usually, like when I'm riding my exercise bike, when I first start out, I can barely do 5 minutes fast. And that would be a lot. And so I just figure, okay, I can only do 5 minutes. And then I have to go back down to the slow pedaling, whatever, for a little while. And so I intersperse those 5 minutes in there, maybe a couple times during the hour that I'm riding that bike at a slow pace. But that's what I want you to do. I want you to figure out what your baseline is. What's the fastest you can do, and how long can you hold it? Is it going to be 10 seconds? Is it going to be 15 seconds? It doesn't matter. It just matters that you take note of that as your starting point. And then, next week, if you started out and you're doing 3 minutes at a time, I know with my mother, I started her at 3 minutes, and pretty soon she was up to 6, and then she was up to 11. So each week she just increased it a little bit depending on how she was feeling. And you'll find that after a while, the 5 minutes or 3 minutes, whatever you're doing, you can actually do a little bit more, and it'll be kind of nice to have that. But I want you to intersperse those high intensity intervals. Start out with only a couple to begin with, and then go from there. Oh, let me just talk about a couple things here. So we're going to talk about how to minimize your risk of injury. And the main thing I want you to remember is to start right where you are, not where you were in high school and not where you were 3 months ago when you stopped exercising for an injury or a vacation or a holiday or just life in general. I want you to keep a record. The research shows that the people who keep a record, if they keep track of it, they are more likely to do it. And it's kind of nice to look at your record if you have a calendar and to look at it over the month and see that you did, so many days a month out of that month, and that you started out at this particular point of 3 minutes of, high intensity. And then at the end of the month, you can actually do 5 minutes or 6 minutes of high intensity interval training. So I want you to pick something that is fun, if you can find that. The reason I do, and a lot of people do, a stationary biking is because it's low impact on your joints. It's very, very good to start with something that's a bike. And you can buy those bikes that are just a short pedaler that fits under your desk, or maybe it's going to be a pedaler that goes up and down like this. They call those mini elliptical machines or something. It's not even a pedal. All it is it's not a circular pedal, I should say. It's not going like this. It's more up and down like that. And you can buy those on Amazon. They range between, like $39, and then they go up to really high amounts. But sometimes those really small ones, they didn't have the best reviews from what I could tell. But there were some that had some good reviews that are still within a range that is reasonable, like right around $100 for some of the other ones. And the other thing that it can be used for, if you cannot use your legs for it, you can use your arms for it, especially the circular pedaler. We put those on a desk or a table in front of people and have them do it that way, because it will be just as much benefit for your brain if you can do that with your arms, even though you couldn't do it with your legs. So I like things that are low impact, things that are stationary like that. Those machines, they can be very boring. I like to listen to music or watch a TV show, not a TV show, but I really like to watch movies. So I might watch a movie on my TV, or I might watch something on my computer, or I might listen to something on like a book on audio. But I really need something to distract me from it, because it does get kind of boring. And that's what I encourage my patients to do. It doesn't do you any good to just be doing it and not, you want a little bit of pleasure while you do it. And I think that's really important. Slow, steady, uninjured, unstressed progress is what we want. We want patience and attention to how you are feeling, so that if you are having a joint that's bothering you, that's aching, that feels like something's pulling, you don't continue. You don't push through it. It's not like my husband used to say, no pain, no gain. That is not true in this case. We want it slow and uninjured. We want no injuries. So a painful joint or a muscle while you're exercising is a message to you from your body, just telling you to back off. Strengthen the muscles around the joint a little bit. Sometimes you need to do a little bit of physical therapy, and you might have to ask your physician for a prescription for that. But anyway, allowing a joint to recover before you try it again. And when you try it again, you need to start at a lower rate. So sometimes I'll have people get not a health coach, but a coach for exercise coach, or I'll have them start with some physical therapy, because some people haven't been moving for years, and it's just safer to start with the physical therapist. They are really good at being able to determine what your starting point should be and what's going to be safe for you, and then kind of help you through that. So really, the idea is to move more and sit less. Sitting is being thought of as the new smoking. It can completely undo the benefits of any exercise that you do. So even if all you do is sit less, your body will benefit from that also. So here's a woman, she has an exercise ball that requires her to balance while she's sitting at her desk. It takes, you can't just sit there. There's some active muscle movements going on to stay on that ball in a balanced way. And then she also has a desk that raises and lowers. So that's a really nice thing to have if you're somebody who has a desk job or you're sitting all the time. And again, those pedalers can be used under a desk, or they can be used when you're sitting on your sofa, and you can just sit on the edge and use the pedaler, or sit on the edge of your chair and use it. Those are really simple things that you can do inside at home that are very safe, and you just have to pay attention and give yourself time to do these things. So just a few guidelines. Choose something that you find enjoyable, something that's convenient. If you can't get to it and you can't do it without a lot of hassle, you're not going to do it. You want it to be inexpensive, so something sustainable. If it costs too much, you're not going to do it. We want something that's going to be a lifetime habit for you. Sitting less, moving more, track your steps. You may actually have more steps in your day than you realize, and that can be one form of your movement. Try to get in the range, though, at least a little bit, where your breathing and your heart rate are increased, but you can still talk. That's going to be a moderate level of effort. If you are really out of shape, then I want you to do it in the range in which you can sing. So that's going to be even a little bit slower, but that will keep you from overstressing your heart and your lungs if you are doing it at a level that you can sing. That's a low level of aerobic exercise. So choose movement that uses multiple body parts if you can, that uses multiple senses. Take a class, do it with people. That's much more fun than being at home and doing it that way. But if you're like me and you don't have time to take a class, I do a lot of things with a video, just in the comfort of my home and my living room. So just make sure that you're activating multiple areas of your brain simultaneously as much as possible. And if possible, to get your breathing up and sweat just a little. Okay? So back to Jerry. He would come home in the evenings and he would eat a large meal. He would sit in his lounge chair for 2 to 3 hours watching TV before going to bed. And Jerry, to say the least, was discouraged totally by the answer that exercise was the miracle medicine he was looking for. He was used to getting that pill and whenever he had a new health problem. And so he was not thinking that exercise was going to be helpful at all. So drawing on his usual routine, they recommended a recumbent stationary bike to replace the lounge chair in the living room. And his wife, Rose, was pretty reluctant to have this in their living room. But when they explained to her how important this was for Jerry's brain health, that this would actually prove to be the most important piece of furniture in the room, she reluctantly agreed to give it a try. So they told Jerry he was to pedal at a slow, steady, continuous pace for 2 hours every evening when he was sitting in front of the TV. And then he was supposed to pedal rapidly for 5 minutes, twice during those 2 hours. And each week, he was going to increase the time of the rapid pedaling sessions by 1 minute each week. He was asked to keep track of it, to use a whiteboard or a notebook, whatever, and to keep track in his notebook how he felt before and after, so that he could discuss it with the doctors when he returned in 3 months. So when he came back in 3 months, what they found was a different person. So what happened was he was much more awake and alert, and he was much more communicative, and he just was a completely different person. He said he was feeling better. He had increased initially 1 minute a week, and by 6 weeks he was up to about, I think he was up to about 11 minutes. And then at the end of the 3 months, he was actually up to 25 minutes at a time for the fast pedaling. So he actually gained some pretty good fitness pretty rapidly. And that can happen, especially when it comes to heart fitness. It goes a little faster. It's sometimes the joint fitness that doesn't go quite as fast, and the muscles and joints take a little bit longer, and you have to be more cautious about that. But he was on a stationary bike, so that was very safe for this very overweight man. And so he came back again after 6 months, and at that time they retested his cognitive function, and he was testing normal. So he had gone from testing as having dementia to testing normal in 6 months. Pretty dramatic. He was feeling really, really good. He was had become quite an avid biker, and he actually bought himself a new bike. So now he was cycling outdoors. Um, so really, it was quite amazing. A year later, he came back, and they did follow-up brain scans on him at that time, and they showed areas of the brain that had been damaged by these mini strokes were actually smaller in size, and other areas of the brain that were related to memory and focus and executive function were actually larger in size. And, this is something that has actually been unheard of in medicine before we started using lifestyle medicine to try to reverse changes in people in terms of dementia and Alzheimer's. We had never seen that kind of change on somebody's brain before. We had always assumed that as you get older, your brain gets smaller. And I would say thousands of times a day in any hospital in the United States, when the radiologist reads the brain scans on people, they make the statement that this is normal brain atrophy of age. So normal age-related brain atrophy. And that just means that the brain is shrinking and we consider it normal. So anyway, remarkably, his positive lifestyle changes inspired his wife to make some dietary changes along with him since she was making the meals. And she eventually embraced regular exercise using the stationary bike in the living room. And now they went ahead and they actually purchased a set of free weights to add to the recumbent bike in their living room. Kind of a sign of their mutual commitment to overall well-being. So really kind of amazing story. So I just want you to be careful out there and pick something that you enjoy and see what you can do to start in a safe way, in a way that's fun or enjoyable and easy and sustainable, and see what it can do for your brain function. So, okay, I will be seeing you all next week. Thank you.